We were discussing Percival's Code of Medical Ethics. What Percival's Code addressed that previous codes did not were concerns about experimental medicine. According to Percival's Code, physicians could try experimental treatments when all else failed, as long as such treatments served the public good. The American Medical Association met for the first time in Philadelphia in 1847. The group devised a code of ethics for members based on Percival's Code. The resulting American Medical Association Principles, currently called the American Medical Association Principles of Medical Ethics, has been revised and updated periodically to keep pace with changing times. The AMA Code is written for physicians, but could also pertain to other healthcare professions. Contemporary codes of ethics are established by the appropriate professional organizations, govern the behavior of their members, and increase the level of competence and standards of care within the group. While they do not have legal authority and must report indiscretions to the proper authority, they do help standardize care by having their members look to the same set of guidelines for assistance. Some examples of healthcare organizations with codes of ethics is the American Association of Medical Assistants, American Health Information Management Association, American Hospital Association, American Medical Association, and the American Society of Radiologic Technologists. An example code of ethics. The Code of Ethics for Medical Assistants deems that they should render service with full respect for dignity and of humanity, respect confidential information obtained through employment, uphold the honor and high principles of the profession and accept its disciplines, seek to continually improve the knowledge and skills of medical assistants, and participate in additional service activities aimed towards improving the health of the community. In addition to their code of ethics, the AAMA also has a creed set forth for their medical assisting statements of belief. They include, I believe in the principles and purposes of the profession of medical assisting. I endeavor to be more effective. I aspire to render greater service. I protect the confidence entrusted to me. I am dedicated to the care and well-being of all people. I am loyal to my employer. I am true to the ethics of my profession, and I am strengthened by compassion, courage, and faith. While one set of things is listed to be a guideline for the society, for the group, the other is a creed, a personal belief statement that lends itself to the furtherment of the society. To further complicate the area of ethics in medicine, we can take it down to a smaller group called bioethics, or a discipline dealing with the ethical implications of biological research methods and results, especially in medicine. Biological research leads to progress in medicine, but leads to dilemmas. Things such as, do people own their own cells, or should scientists own the cells that they have altered? Who should receive organ transplants? Should there be a list of requisites in order to be able to receive organ transplants? Things like fetal tissue or stem cell research. Even though it has led to great advances in medicine, it is very controversial based on people's moral values. And reproductive technologies. So families that are unable to have children can take medications, advancements that often lead to multiple births. Other things such as animal testing. Is it okay to test on animals? Is it safer to test on animals than people, even though we are not comparable? Genetic research, which can narrow down diseases and treatment for diseases, but also could lead to genetic discrimination based on those same criteria. And then cloning. both the cloning of actual individuals, cloning of organs for organ transplants, cloning based for research and testing to compare side effects. If you have a pool of the exact same genetic material, your side effects are going to be the same across the board if they are truly side effects. But all of these areas lead to great dilemmas in thought and procedures for scientists and the community at large. Bioethicists are specialists who consult with medical professionals and help make these difficult decisions, help lead them to the right choices, not just for the advancement of medicine, but for the furtherment of the human species. While medical ethicists or bioethicists are specialists who consult with physicians, researchers, and others to help them make difficult decisions, most hospitals also have ethics committees, which help determine possible solutions to difficult, real-life healthcare issues. Members may include physicians, nurses, social workers, clergy, family members, and community members. And they can discuss things such as Jehovah's Witnesses, faith not allowing blood transfusions, and what that means for a patient that is in need of one. When a case is referred to an ethics community, the members meet and review the case. The committee does not make binding decisions, but helps the physicians, nurse, patient's family, and others involved in it clarify the issue and understand both the medical facts and the alternatives available to help resolve the situation. Ethics committees will also help with conflict resolution among parties involved with the case. So when they are not seeing eye to eye, they try to explain the other side and allow them to come to a resolution that works for all parties. This transitions us forwards into etiquette, which are standards of behavior considered good manners, but these can change based on cultural norms. While in an American household it would be considered polite to ask another man, "How is your wife doing?" in a Middle Eastern household this would be considered rude. So being culturally sensitive can allow you to function at a higher emotional quotient, or EQ, and leads to better etiquette across the board for your patient relations. Most healthcare practitioners are also expected to know protocol, or the standard rules of etiquette applied to their particular place of employment. It can be as simple as when another doctor calls to put them through immediately, or how to deal with patient complaints over the timeliness of a procedure. Qualities for success in healthcare, also known as the 3 C's. Courtesy, the practice of good manners. This can be as simple as self-introduction and explanation of what is to be done, or AIDIT, which is an acronym for acknowledge, introduce, duration, explanation, and thank you. So you want to acknowledge people with a smile, introduce yourself, spend time with them, don't be in a rush to get out of the room, explain what you or others with you are going to be doing, and thank them for their time, for choosing your organization. Then you move on to compassion. Compassion is empathy, sincerely understanding someone else's situations and feelings. Not saying, "I know how you feel," but truly taking the time to understand why they feel, how they feel, and being able to feel it yourself. And lastly, common sense, or sound practical judgment. Can you see a solution that makes sense to you and others in a given situation? So again, the 3 C's of success in healthcare are courtesy, compassion, and common sense. Additional capabilities that are helpful to those who choose to work in the healthcare field include people skills and technical skills. People skills, traits and capabilities that allow you to get along well with others. These can include such attributes as a relaxed attitude when meeting new people, an understanding of and empathy for others, good communication skills. These include writing, speaking, and listening, patience in dealing with others, and the ability to work as a member of a healthcare team. So your solution cannot be the only solution. Being able to discuss it, come to a group decision that leads to the best for the patient, and tact or sensitivity with others and with difficult issues. The ability to impart information clearly and accurately. You want to keep things concise, but you want to cover it fully. The ability to keep information confidential. The ability to leave private concerns at home, and the trustworthiness to be able to have patient information and a sense of responsibility. Technical skills include those abilities you've acquired in your course of study, including, but not limited to, the following: computer literacy, proficiency in English, science, and mathematics, a willingness to learn new skills and techniques because things are always changing in the medical field, an aptitude for working with your hands, the ability to document well, and the ability to think critically. Documenting is so important in the medical field. It's as important to write it down as whether the procedure actually happened. The truth is, if it isn't written down, it is considered to not have happened. And lastly, critical thinking skills or problem-solving skills. Critical thinking is the ability to think analytically using fewer emotions and more rationality. Steps in the problem-solving process. For critical thinking, you want to identify and clarify the problem. It's impossible to solve a problem unless you know the exact nature of what you're trying to solve. Gather some information, do some research, find the true facts of what is going on. Evaluate your evidence. Look through the information gathered previously, the stuff that research turned up. Consider alternatives and implications. So don't just go with the first solution that comes to mind. Come up with multiples and look at the implications that they will lead to based on the implementation of them. And then choose and implement the best alternative. Critical thinking is not easy, but like any other skill, it improves with practice. Lastly, determining if a decision is ethical. One of the easiest ways to determine if a decision is ethical is to ask yourself, if I perform this act, have I followed relevant laws, kept within my employing organization's policy? Does it promote a win-win situation for as many of the involved individuals as possible? How would you react if this act was publicized in the newspaper or on TV? Would you want your family members to know you had performed this act? Or can you look at yourself in a mirror afterwards? Healthcare personnel who demonstrate these qualities and skills, coupled with a working knowledge of law and ethics, are the most likely to find success and job satisfaction within his or her chosen profession. Thank you.